Assalamu alaikum. My name is Dr. Ahmed Raza Khan, and finally, this is that time of the year when the exam blues are at their peak. The students are done with their written examinations and now they are up for Viva and OSPE examination. And today I'll be sharing about more than 200 Viva questions with the students, which will also include the short questions that are asked in OSPE examination. So let's start. The thing is that if you go through all these 200 questions, there is not a single question that can be asked beyond these 200 questions. It's going to be like within 100 questions, but I have expanded them to almost covering every aspect of forensic medicine and toxicology. So the question number one is define forensic medicine, define toxicology. Who is the father of toxicology? Define firearm weapon. Elucidate what is bolt action, what is a semi-automatic weapon, and what is an automatic weapon. Define forensic anatomy of scalp. What are buttresses of skull? What is the mechanism of froth formation in antemortem drowning? Are diatoms conclusive evidence of antemortem drowning? What is superfetation and how is it different from superfecundation? What is volitional activity? Describe adipocere formation. And what is mummification? What are the common law torts? Define qisas. Define diyat and state its recent value. Define arsh. Define daman. What is shaja? Describe the sections ranging from A1 to A6. What is jurghair jaifa? And subclassify the sections ranging from E1 to E6. Define L1, define 337L2, define 337G, 337J, 337H, what is 337C, and finally, what section, legal section is covered by section 335. What is LD50, what is ED50, and how do you calculate the therapeutic dose? Define TLV, the threshold limit value. What is MAC, maximum allowable concentration? And what is AMDAC, multiple doses of activated charcoal? Where is it used? Then you should know what activated charcoal is and what is super activated charcoal. What is tram track appearance? What stake is noia? What is cattle trucking? Define autoerotic asphyxia. What is the medico-legal significance of lucid interval in forensic medicine and as well as in toxicology? What is the medico-legal significance of oxidative phosphorylation in clinical toxicology? What is sledgehammer slaughterhouse effect? Differentiate the coup and the contra coup injury theory. What are the autopsy techniques? Which cavity in autopsy is to be opened first and why? Is it the head or the chest or the abdominal cavity? What is automatism? What is the difference between an exhibitional poison and exhibitionism? Who is a hostile witness? Is transgender and transvestite same or are they different? And if so, then what is the difference? What is the medico-legal significance of benzodine test? What are the confirmatory tests for blood? In which condition can semen serology be negative in case of a sexual assault? What is Casper dictum? What is raindrop appearance? Define Marsh test. Describe Branish test. What is the difference between impotence and sterility? How can you calculate the age of a bruise? How do you calculate age of an abrasion? And then finally, how do you assess the age of an incised wound? What is iskate hamal? What is iskate janeen? Define blast injuries. What findings will you find in hypothermia in an antemortem as well as in a postmortem examination? What are the autopsy findings in death due to starvation? Describe PCR, the polymerase chain reaction. How do you assess the age of an individual? How do you carry out the age estimation of a bone? How do you carry out the age estimation from teeth? And how do bones determine a race of an individual? How do teeth determine the race of an individual? What are Paltov hemorrhages? What are petechial hemorrhages? What conditions do a plaintiff has to fulfill in order to carry out or plead murder in self-defense defense? What is St. Anthony's fire? Classify gunpowder. How do you detect the gunshot residue? What are the antidotes for the following? Organophosphorus compounds, methanol, datura, opioids, and benzodiazepines. What are chelating agents? What is the pelvic dissection procedure in case of a criminal abortion? What is a primer? What is the composition of a primer in a firearm weapon? How do you assess the rule of 9 in burns in adults, and how is it different, and what are the calculative formulas in children? How to calculate the body surface area in case of extensive body bruises? What is the cyanide antidote package? Autopsy findings of heart in case of high voltage electric shock death. What is commotio cordis? What is subjective and objective identification? What are their differences? What is Hatter shakes? Define the addiction criterions. Upon which criteria do you eventually label a person as an addict? 3 lines, very important lines in toxicology: the Burtonian line, the Clapton line, and the Mies line. What are the differences, and in which poisons are they predominant? What is punctate basophilia? What is the medico-legal significance of Davidson body? What is the Casper statement regarding the male potency? Define loco parentis. How do you opine a medico-legal opinion in case of an alcohol intake that is brought in by the police? What are the elements of crime? What is the principle of phenolphthalein test? Classify hallucinogens. What is the doctrine of informed consent? What is testamentary capacity? What is the Workmen Compensation Act and what does it tell you about the factory workers? What is minor and major disability? How do you assess age from dental data? What is the differential diagnosis in case of a person who is brought in with an allegation of alcohol intake? What is the differential diagnosis of pinpoint pupils? The clinical presentation is just clinically the person is presenting with pinpoint pupils. What are the things that come to your mind which include the clinical diseases as well as the toxicological differential diagnosis? Define and classify the lacerated wound. What is retrogressive phase of life? Define reaction time. What is opisthotonus? What is an ideal homicidal poison? What criteria does it fulfill and which poison falls in this category? Define sections 7 to 13 of Mental Health Act. What's marbling? What are skin slips? Opine in case of a putrefied body. How do you do the postmortem and what opinion can you give regarding that putrefied body? And then how do you formulate an opinion in case of a fresh body with cause of death suggestive of vasovagal shock? What is res ipsa liquitor? What is Valencia non-fit injuria? How do you assess a full-term fetus on gross autopsy findings as well as on radiological examination? What are types of rifling and its medico-legal significance? How do you estimate the range of distance in case of a firearm weapon in both rifled weapon as well as in smoothbore weapon? What are the biochemical changes after death? Define toxicity rating. Classify antidotes. What is the antivenom therapy composed of? What is the differential diagnosis of arsenic poisoning? What is aging of cholinesterase? What is organophosphorus delayed neuropathy, OPDN? What is the protocol of management of a case of poisoning? Why dextrose infusion is contraindicated in a comatose case of suspected chronic alcoholism? How to opine cause of death in case of ligature strangulation? What are causes of death in a fire? What are causes of death in case of burns? Define the pathophysiology of cardiogenic shock. What are the differences between low voltage current and the high voltage electric current? What is circumstantial evidence? What is corroborative evidence? What is professional misconduct? Poison classification. Carboluria, define it. What is ochronosis? How do you differentiate the necrosis in acid and alkali poisoning? How do you calculate the BAC, the blood alcohol concentration? What are the mechanics of a breath analyzer? Medico-legal imputations of alcohol intake. What is the difference between phosphine and phosgene gas? What is the duration of detection of alcohol in breath, in blood, in urine, and in keratinized tissue? Up to how much time interval can you detect alcohol in all these breath, blood, urine, and keratin tissue? What is hippus or pupillary athetosis? What is xanthopsia? What is a paradox gun? What is the difference between qualified and absolute privilege? Differentiate McNaughton's rule versus the Durham rule. What are the Cox postulates? What is Ewing's postulates? What are the medico-legal systems of the world? Define types of anoxia. What are the contraindications of gastric lavage? Enumerate factors affecting toxicity. What are the antidotes for the following? Acetaminophen, lead, iron, arsenic, carbon monoxide, and methanol. What is metal fume fever? What is the pathophysiology of rigor mortis? What is methanol toxicity? What is algor mortis? What is livor mortis in different poisoning cases? What is the difference between a nucleosome, nucleoside, and a nucleotide? What is the difference between negative and obscure autopsy? What is virtuopsy and psychological autopsy? Define superimposition photography. What is the microscopic appearance of a human hair as compared to cotton fiber as well as the wool fiber? What is the difference between the red blood cells among human RBC, avian RBC, camel RBC, and goat RBC? What is Christmas staining? Teachman test? Takayama test? How do you give a medico-legal opinion in case of a blunt trauma? In case of a firearm injury? In case of a rape victim of sexual assault? In case of a sodomy? In case of sexual potency? And in case of alcohol intake? Define latent fingerprints. What is the microscopic appearance of human hair of various origin like head hair, mustaches, pubic hair, and damaged pulled out hair versus the cut hair? What is the oxalic acid Christian saying? What is active and passive immunity? What is meant by 12-bore gun? What is choking and its types? What is Section 299C? What are the key points of Injured Person Act? Define Organ Transplant Act. Define and classify euthanasia. Differentiate between sudden infant death syndrome and battered baby syndrome. What is the medico-legal significance of flotation test, and when is it false negative and when is it false positive? What is uterine souffle? How do you estimate stature of an individual from individual bones, like in case of a blast injury? What is the chronological order of ossification of cranial sutures? What is sui poison? What is a subpoena? How do you differentiate between culpable and non-culpable murder? And what is a justifiable homicide? Define dying declaration. Define dying deposition. What is metallization? What is whiplash injury, clasp knife rigidity, hyperextension? Differentiate between a common witness and an expert witness, and what is a hostile witness? What is the difference between purging and perjury? What is paternalism versus patient autonomy? What are the responsibilities of a registered medical practitioner? Define consent and its subtypes. What is the difference between consent and assent? What is the difference in civil and criminal negligence? Just state in one line. Klinefelter versus Turner syndrome, what is the difference? Boyd versus Gustafson's criterion, what are these criteria and what are their differences? Autopsy definition and its types. Objectives of a medico-legal autopsy. Postmortem artifacts. Air embolism in cerebral veins. Is it an autopsy finding or an autopsy artifact, and why? Explain it. What is the cause of death? What is manner of death? And what is mode of death? Calculation of time since death is calculated by rate method and concurrent method. Define these methods. What do these methods cover? What is Rebotham theory as far as the mechanics of skull fracture are concerned? Differentiate between an open head injury and a closed head injury. What is the medico-legal significance of bevelling phenomena? Define injuries to pedestrian in a road traffic accident. What are the mechanics of blast injuries? Define hypothermia. What is vital reaction and what is negative vital reaction? What is the difference? What is the difference between an embolus and a postmortem clot on autopsy? How do you appreciate it? How much quantity of air embolus can be fatal? The difference between lynching and Burke phenomena. Suicidal hanging versus homicidal strangulation. What's Locard's principle? What is punctate basophilia? Compare the difference in bite action of a leopard, viper and a sea snake in their appearance. What is the difference between poisonous and a non-poisonous snake? What are the 5 symptoms of Jimson weed poisoning? What is the medico-legal significance of semicarpus anacardium? How much percentage of alcohol is present in beer, wine, vodka, whiskey and rum? What is the use of entomology in forensic medicine? Differentiate between dactylography and DNA fingerprinting. What is Arsing phenomena? Define Dangerous Drugs Act. How to decide between the injury, that whether it is fabricated or is it genuine. So these were almost 222 questions of the Viva that I've covered. And one piece of advice for all the students, that please go through all these questions and try to get the answers. If you are unable to get the answers, please leave a question in a comment box asking me about any ambiguity or any question that you are unable to find the answer to. Because the main thing is, it's not only the students that go through all these lectures and the videos. There are teachers also that go through all these lectures and videos, and they get ideas from all this Viva questions, that what to ask and when to ask. So before the question starts popping up in the Viva room to you, you better be equipped with all the answers. So I'll be making a next video with giving you a sample of the answers. I'm not going to give answers of all the 222 questions to you. You need to do your own brainstorming and you need to find the answers on your own, and the most of the answers you already will be knowing by now, because it is the time of the year that you are more well equipped with this subject than anyone else. You have been there, you have done that, you have done the written examination, so you are well aware and well equipped and have the almost complete knowledge of the subject as far as third year MBBS is concerned. So you need not lose your heart, and yet still, if you find any question that is difficult, please let me know and I'll supply the answers to you. I'll be making a complete video of the OSPI slides with solved answers of the OSPI questions, and I'll also be giving you solved answers of some of the difficult questions of the Viva questions that I have mentioned here. And other than that, if you find something difficult, do let me know. Thank you.